Yes, now I want to talk about clinical risk markers, not laboratory. Cigarette smoking, increasing the risk chronic diseases, cardiovascular, bronchopulmonary. Heating instead the burning tobacco can lower this risk contribution to tobacco harm reduction. What is tobacco harm reduction? Is complementary approach to tobacco control is increasingly being adopted. It rests it rests on the notion and the continuum of risk, building on the insight that people smoke for the nicotine but die from the tail. The United States, the Family Smokers Prevention and Tobacco Control Act authorized the U.S. Food and Drug Administration to control the marketing to the novel tobacco product. The most prevalent heat-not-burn product today is tobacco heating system, which heats tobacco at a temperature that does not initiate combustion. And they have been marked in the more than 4 countries since 2000. Brand name ICOS. Materials and methods of this disease. The study with 984 adult American smokers examined whether favorable change occur in the 8 co-primary endpoints, very different indicative of biological and functional effect when cigarette smokers switch to the heat-not-burn tobacco heating system. We divide 2 groups. One group switching to the using electronic tobacco heating system, number of participants 488, and the second group continuous smoking, number of participants 496. In this slide, you can see very different clinical markers, including respiratory impairment, acute exposure for cardiovascular system, oxidative stress, chronic obstructive disease and cancer, white blood cells inflammation, cardiovascular system disease, cancer and bronchopulmonary disease, genotoxicity, tumor development, endothelial dysfunction, and next thrombosis formation for cardiovascular system and lipid metabolism and cardiovascular system. In the slide illustrated THC versus cigarette smoking group effects on the primary endpoints. You can see effect, confidential interval, and p-value in very different clinical and laboratory markers. Model-based month 6 effect estimated in the 8 co-primary endpoints. The predomination THC use category group was stratified by quartiles, 1, 2, 3, and 4 quartiles. Higher levels are indicative of higher levels of cigarette smoking. In first point 11 dehydra TBX2 model, and the second picture 8 APPHG to alpha means ratio, and the third and fourth picture, favorable changes were also observed in platelet activation, endothelial dysfunction, and oxidative stress. In next slide, illustrated total NLL, FEV1, low density cholesterol, and leukocytes. Compared with continued cigarette smoking, switching to THC result, reduced exposure to cancerogen, higher FEV1%, low density lipoprotein cholesterol increase, and reduced white blood cell counts in these points. THC cigarettes, you can see a light gray, and dual use cigarettes dark gray, percent reduction, and so exhaled and difference between THC and dual use versus cigarettes intervals at month 6. Conclusions in the study: the main outcome was favorable change 6 months after baseline, with statistically significant improvement in 5 of 8 biomarkers of effect when smokers switched to THC tobacco heating system compared with those who continued to smoke cigarettes. All endpoints showed favorable change in the same direction as with smoking cessation, and improved biological effect were observed in smokers who predominantly used THC compared with continued cigarette smoking, with similar nicotine levels of both groups. Improvement 5 of 8 biomarkers of effect are supportive to the research hypothesis, suggestive of disease risk reduction potential for smokers switching to THC instead of continue to smoke cigarettes. And what can we do? Smoking is the main modified risk factor of NSD. Nicotine, also not harmless, is not a main problem. Smoking cessation should become an essential component of NSD prevention, of course, treatment. The modern scientific approach involves the cooperation of a doctor and a patient. To do this, it's necessary to develop the doctor's communication skills and expand the exciting tools. It's necessary to simplify the possibility for patients to receive information. It's necessary to adapt modern regulation in proportion to the harm caused. Thank you.